Hi, everyone. I'm Justine Gincola, host of Innovators, a series where we feature unique perspectives from our customers, partners, and leaders across the healthcare space. And today I'm here with Shawn Stack, Director of Perspectives and Analysis for HFMA. Hey, Shawn, welcome to Innovators.
Hi, Justine. Glad to be here. Thank you.
Of course. You're fresh off the scene from HFMA. Heard it was a great show, and hope you're able to get some rest after all the travel.
Definitely lots of people there this year, that's for sure.
Great. Well, just a couple questions today. I want a little recap of the show. You're just coming off the conference. What are some of the top priorities that you're hearing from your members at this year's conference?
Yeah, so as you know, Justine, healthcare is just very crazy right now with razor thin margins and just regulation after regulation coming out of DC and at state level. So I think some of the biggest top priorities that we're hearing from hospitals are, supply costs just continue to skyrocket. Drug costs, of course, are continuing to skyrocket. Labor costs are still up, but they're coming down just a little bit, especially as it is associated with contracting rates that soared, of course, during the pandemic. Decreasing reimbursement trends that we're seeing, increased in denials from payers, and continued slowdown in claims processing. And again, razor thin margins and hospitals either closing or, really at the brink of closing around the country. It's very interesting to listen to, our large academic medical centers or health systems around the country talk about the razor thin margins. And then you walk across the aisle and you talk to some of the smaller rural county hospitals, and they kind of like shrug and say, we've been dealing with this for 15 years. This is just another day in the life for us. But it does echo. The razor thin margins are really impacting the nation.
Yeah, absolutely. We're hearing the same thing, and I know that these systems are under quite a bit of pressure. A lot going on, but we're hearing that the need for health systems and employers to be competitive in the marketplace as consumers are more aware of health needs and the costs associated with those services. So what are you hearing around price transparency and the need to be competitive with published reimbursement rates?
Yeah, so that's an interesting question, and a question that is definitely in my wheelhouse. This is something that I've been focusing on for almost 8 years since we've been talking about increased transparency in healthcare, and now NSA, of course. So this is my highly focused area. My answer would be hospitals for several years now have been focused on being competitive in their markets. And I really don't feel this far that transparency has done a lot to impact that and the items and services as they are being priced. I know that sounds a little radical, but I don't think we've seen a lot too much adjustment, because I think hospitals did that early on shoppable services such as imaging and common procedures and items. That being said, we are seeing growing concern over disruption in the healthcare market around shoppable services. And I think we will see a strong focus on legacy providers really dialing up the focus on controlling their costs and taking a fine point pencil to contracting with supplies and providers on items and services. I think what you're saying is those MRFs that are out there on contracted rates and the MRFs that the hospitals are publishing. I don't even think we're close to getting good data in most regions of the country on those contracted rates yet. The files are too confusing. They're too large. There's a lot of payers out there that are not at all posting for all the contracted rates in their regions because no one's been able to really focus audits on those yet. But I think that's coming, and I do think that it will have an impact eventually. I think within the next year we're going to start seeing some focus on those contracted rates.
Okay, good. That's promising within a year.
That's Shawn's opinion right there. Looking at those files and Yeah, and working with some, like Turquoise Health and what they've done to review that.
Yeah,
Yeah.
absolutely. All right. Well, we'll certainly will hope that things can turn around within a year. But
Yeah.
so we've been hearing from these sessions at HFMA the importance of physicians collaborating more closely with billing and coding staff. Have you been hearing from your members anything kind of around this? And if so, have you heard how they're addressing it?
So last year I chaired over 8 executive councils across the nation for HFMA, which is healthcare leaders, CEOs, CFOs, revenue cycle vice presidents. I can tell you honestly, Justine, this is one of the very top conversations that we have at every executive council meeting. This is definitely at the forefront of our discussions. I think we're beginning to talk about this in a better format, explaining ourselves. We're not wanting clinicians, I'll say clinicians across the board, because I'm talking about nurses, doctors, everyone, to do more in financial conversations with patients necessarily. We're asking them to work with their financial staff to build that trust with patients, to walk them across the aisle to Marjorie, who's a financial counselor or a case manager, and talk about how they can pay for that bill and get them the help that they need. I think we need to work on building that trust, and there's really no one else that's trusted more in healthcare continuum than doctors and nurses, right? I've always told, we teach a class to chief medical officers at Carnegie Mellon, HFMA does, and I always tell the doctors that are in those classes, because we teach them on finance and revenue cycle. And I always say, as a doctor, as a professional in your personal life, do you like to talk about finances and resources and what you have in the bank and how much you make? And of course, everyone always answers no. So then I tell them, well, you know what? Let's put you in a hospital gown when your backside's hanging out and you're freaked out about your health care, and then ask you to talk about your finances and what's in your checking account. And they're like, wow, we've never looked at it that way. I said, well, that's what we're doing to patients. So we really need to have those holistic conversations from a clinical care team and a financial team with that patient, to let them know that we're not just there to take money out of their bank accounts, that we're really there screening them to help them with their medical bills. And I think that really echoes. And I think those are the funny, but yet realistic conversations that we do need to be having internally with staff, with all the care team. Does that make sense?
Absolutely. I mean, you can even think of yourself as the patient, put yourself in those shoes. And I mean, how would you want to handle that situation as that patient? So yes, absolutely.
Yeah, Justine, and what you're saying is exactly what we should be saying. We need to stop calling patients consumers, because buying a product is not emotional usually. But getting healthcare when you think you could die, or when you think your life expectancy is being influenced, that's really emotional. And that's what's tied to the word patient and not consumer. And that's something, as we get hardened as healthcare professionals, and it's inevitable that we do, we realize that these people are patients and not just consumers. And there's emotion wrapped up in this, right? So
Absolutely. And
I think that's what you're saying.
Exactly. Yeah. And I think when we're on this side of it, when we can put ourselves in, that different perspective, that's how we're gonna help make a change. So
yep, I agree with you. Great.
I love it. Well, that's all I had for today, Shawn. I appreciate you joining us today and being an innovator in the healthcare space. Thank you.
Thanks, Justine, and thanks for leading the good cause.